Who is an ideal candidate for hair transplant? A male who's suffering from androgenic alopecia, a female suffering from female pattern hair loss. Both of them are ideal candidates for hair loss, and these two are by far the most common cause of hair loss in both males and in females. So for people who are completely bald, you don't need to follow any medication after the transplant after a few months, because whatever hair we are implanting is going to be the transplanted permanent hair. In people who have got existing hair, or in people where we are just doing the hair length correction, it is very important for them to understand that your hair might fall off, which is the existing hair. The existing hair might fall off, so it's important that you take care of the treatment and also other adjuvant therapies to ensure that your existing hair doesn't fall, and the transplanted hair is always going to be there to supplement the result in that area. Of all the hair transplant procedures, DHI is the least invasive because it is end-to-end done only by the surgeons, and the instruments that are being used are the finest of all. We use punches which ranges from 0.7 to 0.8 millimeters. The implanted needles are also 0.9 or 1 millimeter in size, and there is no incision, no cutting and stitching which happens unlike in FUT procedures. And in the implantation procedure also, there is no need to make a slit beforehand using a blade or a needle. Here it is always the implanters which are doing the job in the normal looking skin. Because of that, there is almost a zero recovery time. You can resume your activities in a couple of days post procedure. You can go back to your work, you can resume your job, and there are so many people who are doing the procedures and flying back to the US or UK in just 2 to 3 days time. And we don't even give painkillers. You just have to take an antibiotic for 4 to 5 days post procedure, and that's pretty much the only thing that you need to do.